Hello, everyone. Today is Monday, October the 20th, 2025, and you have joined Ask a Care Navigator, Mondays with Maureen. Hello, everyone. My name is Maureen Williams, and I'm the Director of Care Navigation here at Four Seasons, the Care You Trust. And we try to create this space on most Mondays to talk about issues associated with living well and aging well, and perhaps how Four Seasons may be of service. As of October 1st, I am thrilled to announce that, and we are so grateful that the Van Winkle Law Firm is serving as the title sponsor for Ask a Care Navigator Mondays with Maureen. I'm so thankful. The Van Winkle Law Firm is one of the most respected and established law firms in North Carolina, providing expert legal representation for individuals, families, and businesses in personal, commercial, business, and estate planning matters. Should you require more information, and I do hope you go to the website to learn more, please go to www.vwlawfirm.com to learn more and to schedule a consultation. And I put that information in the chat box. Thank you to the Van Winkle Law Firm. I am so grateful. Well, today's session is called Medicare Basics. And many of you may not know this, and many of you may, but it's now open enrollment season for Medicare, October 15th to December 7th. Some of you are very aware of this. Some of you are not. Some of you may not think you need to pay attention to this, but some of you, particularly of adult parents or loved ones who are Medicare eligible, there's some opportunities for them right now, perhaps to refine the plans that they may have. So let's talk about some Medicare basics, just Medicare basics. I want you to be informed. Now, right here, what's sharing the screen with me, this is the Medicare.gov homepage. If you go to Medicare.gov, this is what you will see. And you see in the top left there of your screen that it's open enrollment now through December the 7th. If you need to make any changes to your Medicare status at all, now's the time to do it. And there's lots of help for you to do this. Also on this website, Medicare.gov, and I put that in the chat box, there's a way to log in or create your own account to find out what your Medicare status is, what your eligibility is, what things you're eligible, how to find providers. There's so much information. And I do encourage you, if you or a loved one are eligible for Medicare, please, and you're viewing this right now, clearly you're tech savvy somewhat, please look in that account or create that account for yourself or your loved one. Okay, lots of information there. I find that many people have lots of misconceptions about what Medicare will cover, and many people don't realize how much Medicare can help them at times and the various kinds of plans. Okay, well, let's do some Medicare basics. It's an alphabet soup sort of situation. So I'm just going to skim the surface, and we'll start going deeper in future sessions, and I'll tell you about one at the end. Okay, Medicare Part A, and I'll stop sharing here for the moment. Medicare Part A. Medicare Part A has no premiums, zero. If you're eligible for Medicare, you're eligible for Medicare Part A. It's only been less than a handful of times in my career that I found someone that did not have Medicare Part A for some reason. I think it's because they simply forgot to sign up and thought they could just go through life without it. It's free. You're entitled to it. You've put in the system for a long time. Sign up for Medicare Part A. There are no premiums. But what does Medicare Part A cover? It covers hospitalizations, home health care, skilled home health care, hospice care, and skilled rehab services, or sometimes called skilled days or Medicare aid, Med-A days. So hospitalization, Medicare Part A covers hospitalization, home health care, hospice care, Part A, and skilled rehab services or Med-A days. And that's for a defined period of time. None of these four services are indefinite. Okay, Medicare A. Medicare B. There are premiums associated with Medicare Part B. You have to elect Medicare Part B. Please do so. I'll tell you what it covers. Medicare Part B covers outpatient services, physician office visits, medical supplies, and preventive screening. Let me repeat that. Medicare Part B covers outpatient services, physician office visits, medical supplies, and preventive screenings and services like diagnostic work and lab work for screening, your annual screening. There's a small premium you pay if you're Medicare eligible. I encourage you to sign up for this. Can you imagine paying for all of your outpatient services or outpatient physical therapy or going to your doctor and paying for all of that out of pocket? That's what you would be doing if you don't have some other mechanism to cover that in your life and some other product. Okay, so Medicare A, no premium. Medicare B, premiums. Then there's Medicare D, and there are premiums associated with Medicare Part D. And basically, Medicare Part D is Medicare drug coverage. This is the Medicare plan that covers many medications. It covers both generic and some brand name drugs. It doesn't cover everything. You've heard about some of this in the news, perhaps. It's optional, but highly recommended. I work with clients who never thought they would need this and didn't sign up for it and facing huge sums of money to pay for their special drugs for some sort of crisis. It's painful. It's optional, but highly recommended. There is an initial enrollment period for Medicare Part D. And if you don't enroll during that initial enrollment period, there is a late penalty if you enroll outside of that initial enrollment period. So watch your mailbox when all that Medicare stuff starts flooding you. Pay attention to it. And I'll give you some resources to help you sort that out. And guess what? To update your Medicare Part D plan, your Medicare drug plan, now is open enrollment, October 15th to December 7th, every single year. If you want to evaluate your Medicare Part D coverage, now's the time to do it. And I'm going to tell you how to do that here very shortly. Perhaps there's a plan out there that's better for you, that costs less, provides more coverage for the medications that you take. Why not, right? You can switch now. All this open enrollment stuff goes into effect January 1st. Okay, there's another type of Medicare. It's called Medigap sometimes, or you might hear it called other things, but basically it's supplemental health insurance. Okay, there are premiums associated with that. If you have traditional Medicare, which is Medicare A and B, and Medicare A and B don't cover everything that you might need. There might be co-pays, or there might be people out of network, or the charges that the doctor is providing, charging you are above the reasonable and customary charges. So you're responsible for the balance, or any co-pays or co-insurances. That's why a Medigap plan, or it's called a Medicare supplemental health insurance plan, and those have different letters too, types A through D, F, G, and K through N. Again, this is a time to examine those as well. These are private insurance companies and that provide coverage to pay above what Medicare Part A and B will cover for your healthcare needs. It's optional, but highly recommended if you can afford it. Highly recommended, because believe me, once you start paying co-payments on lots of physician visits or hospitalizations, that adds up so fast, and your supplement will cover it. So that's Medigap. There are premiums. This is where you can shop around in the market out there. I'll tell you how to do that in just a minute. Then there are Medicare Advantage plans, and these are Part C. So we've got Part A, that's hospitalization and home health care and hospice and skilled rehab. We've got Part B, that's physician office visits, outpatient services, medical supplies, and preventive services. We have D, which is Medicare drug coverage. We talked about Medigap, and then we hopped right back to Part C, Medicare C, which is basically Medicare Advantage plans. Sometimes those are abbreviated MA plans, Medicare Advantage plans. These plans are offered by Medicare-approved private insurance companies. They have to have entered into a contractual relationship with Medicare to be able to provide Medicare Advantage plans too. And basically, these private insurance companies, once you agree and sign up with them, and now's the time to change your Medicare Advantage plan, they administer your Medicare A, your B, and your Part D. Hear that clearly. Medicare Advantage plans, If you enter into a contract with one of those plans, that plan then administers on your behalf Medicare A, B, and D plans. Okay? They do provide additional products and services. Yes, many of them will provide dental care. Traditional Medicare doesn't do that. Vision care, traditional Medicare doesn't do that. Hearing care, traditional Medicare doesn't do that. They do provide additional products and services, but basically, they provide an additional layer between you and Medicare. They administer the Medicare funds out to you. So you really have to be very savvy about what you're signing up for. They have some great products and services. There's no doubt about that. But if it's not going to meet your needs, think about other options. Right now, open enrollment for Medicare Advantage plans. So if you want to change your Medicare Advantage plan that's going to administer your A, B, and D Medicare, now's the time to do it. So I keep saying that I'm going to tell you how to do that. You can go to Medicare.gov if you feel comfortable working through the screens there and looking at the different plans. Absolutely. I know people that do that regularly every year. I know I regularly refer people to Medicare.gov throughout the year. Take a look at it. Open your account. However, no, not however, and in most states, and certainly here in Western North Carolina, in the various area agencies on aging, regions A, B, and C, there are the SHIP programs, SHIIP, Senior Health Insurance Information Program. We love ours here in North Carolina. I think they do a fabulous job. I've even had to work with the plan at state level for some of my clients over the years because they had some really unusual circumstances. I love referring people to the SHIP program. And guess what? It's free. It's free. All of the area agencies on aging and here in Western North Carolina, and throughout the country will have access to this Senior Health Insurance Information Program. It's free. Right here in Western North Carolina, I'm standing in Asheville, North Carolina at the moment. That's Region B, which covers Madison, Buncombe, Henderson, and Transylvania counties. The SHIP program is administered through the Council on Aging of Buncombe County, which is 828-277-8288. All you have to do is call. That's all you have to do. And you can either come in person or they can do it, have a meeting with you virtually or over the phone to review your medications, review your physicians, review what your goals of care are, and what's the best plan for you. This is the time right now to make changes to your Medicare Advantage plans and your Medicare Part D plans. Or if you're on traditional Medicare and you want to switch to an Advantage plan, now's the time to do it. If you're on an Advantage plan and you want to switch to traditional Medicare, you can do that anytime during the year. So these are just the basics, just the basics. If you have any questions about the SHIP program, Senior Health Insurance Information Programs, just call your local area agency on aging. Google area agency on aging for me, for my location. And you'll get a phone number about that. And you can call and ask about the SHIP program. I'm a huge fan. And I just met the new director of that program. Well, she's new to me. I hadn't met her before. And I'm going to ask her to join our time here one day to talk more about what SHIP can do for you. And the best part of it, it's expert advice from SHIP advisors, many of whom are volunteers who are immersed in all things Medicare. And they will work their very best to make sure you get the best plan that works for you. I think that's good news. And I think that's a great part of living well and aging well. So that was the basics of Medicare today. Medicare A, Medicare B, Medicare D, the Medigap, Medicare C, which is also the Medicare Advantage plans. That's the alphabet soup. And then a great resource to make all these changes and get questions is Medicare.gov, when I had the homepage up here earlier, or go to the SHIP program. Call the SHIP program where you live, Senior Health Insurance Information Program, SHIIP. Free. I love that. That's my favorite four-letter word, free. All right. So during this open enrollment time, we're going to be interspersing our talks about Medicare matters associated with that. And I'm delighted to tell you that my community colleague, Jennifer Francis, who knows all things Medicare Advantage, she's going to join us next week to kind of coach you through and talk you through Medicare Advantage plans to see if that's best for you. I hope it gives you some information you can use. So that would be next Monday, October the 27th. As always, if you have any questions or comments about anything associated with Four Seasons, call us 866-466-9734, or please go to our webpage, which is fourseasonscare.org. You have to spell out the number 4, fourseasonscare.org. We're delighted to help you in any way that we can, and there's lots of good information on our website as well. I hope you have a wonderful Monday and happy fall, y'all. Take care.